Nail fungus is an infection of the nails occurring both on the hands and feet, but certainly more prevalent on the feet due to the environment that feet find themselves in. This condition generally thrives in dark, moist environments, so when you consider wearing shoes and socks all day along with perspiration that occurs, it ends up being a perfect growth media for nail fungus.
The true, tough to get rid of fungus actually grows underneath the nail. As it grows, it forces the nail up off the nail bed and the nail becomes thick, crumbly and discolored, ranging in color from yellow to brown. There may also be an odor. It is not uncommon for these infected nails to then spread to the remaining healthy nails on the foot. It is also not uncommon for nails to fall off and, unfortunately, in most cases grow back the same way if not properly treated. The problem with nail fungus is that it is both unsightly and it can be a health hazard. When the nails get too thick and discolored, they can actually hurt enclosed shoes. Because of the thick, irregular nature of the nails, they can press into the skin on the adjacent toes and cut the skin, thus increasing the risks of a bacterial infection. This is particularly dangerous in diabetics and those with poor circulation.
Treatment can be difficult because of the fact that fungus grows underneath the nail and thus the nail actually protects the fungus. The gold standard at this point in time is oral Lambazole. Precautions need to be taken and not all patients are candidates for this type of treatment. Contrary to popular misconceptions, Lambazole can be a very safe drug if properly prescribed. This means confirmation that the distorted nail is actually true fungus and blood tests. One performed before starting Lambazole and the other midway through the medication. For those who cannot take oral Lambazole, there are other options. One is the application of topical medication. However, not all medications will work, and even those that do can make for a long treatment process. Nail is made up of fat and protein. Topical medications with a base made up of water or alcohol generally will not penetrate the nail, so their application is a waste of time. Secondly, if the thick discolored nail is not true nail fungus, most topical medications will not work at all. A nail sampling must be sent to the laboratory to confirm true nail fungus.
Lastly, laser surgery for the treatment of fungus nails has been advertised on the internet and in local newspapers. Unfortunately, the only clinical trials that have been performed so far is one small study conducted by the manufacturer of the laser unit. This study has to be viewed with some degree of skepticism because of who sponsored it and its small size. However, this laser unit is FDA approved for use in skin conditions in the United States, and it is approved for use in fungus nails in Europe. Hopefully, larger studies will confirm the findings of this small study. Virtually no insurance companies will pay for laser treatment of nail fungus, and the current prices advertised seem to start at over $1,000 and up. Perhaps as more doctors start doing laser surgery for this condition, the price to the consumer will come down.